person becomes in need of care, there's a couple different options that they have. Of course, I always recommend the first line of defense against long-term care is long-term care insurance. For some people, that's not available, either due to health, age, or they can't afford it. So what other options are available to a person who's going into care immediately, or maybe has been in care for several years and has been spending their life savings? That's where we look to a crisis plan or a spend down plan. And essentially, this is where we go in and analyze a person's estate and use the applicable Medicaid law in order to protect as much as we can. Many times it's well over 50% of the estate, including the home, and we can go in and take advantage of the laws that Medicaid has laid out to protect a person's estate, protect their life savings, and protect their home for their family. For a Medicaid planner, collaboration is crucial because with the laws ever changing, legislation changing, there's a lot of challenges that a Medicaid planner will face. And maybe not even a Medicaid planner, maybe someone that runs across a client who needs some sort of Medicaid planning advice. Being able to collaborate with other Medicaid planners across the country and provide whatever the client needs is a huge advantage because each state law is different. While Medicaid does have a federal blueprint, each state has their own little caveats that are different. And if a Medicaid planner doesn't know those different caveats, then they can make a mistake or they might not do the thing that's appropriate for the client. So being able to draw on the expertise of multiple Medicaid planners across the country is an invaluable resource to have in order to best serve the client. You know, the field of Medicaid planning can be a very daunting field. A lot of times when a client presents itself, it may not even be the actual client, it may be a family member who's just had to put their loved one in a care situation that maybe they didn't desire that situation, maybe they didn't want to put them in the facility, but they had to due to health reasons. And so a lot of times clients are coming in, they're already worried about their family member's health. That's the number one thought on their mind is their loved one. And then on top of that, you have the financial situation. Complicated laws. You have a nursing home telling them one thing. You may have another financial advisor telling them another thing. You may have a brother-in-law telling them something else. It's very confusing and a very daunting task to sift through all the information because there's a lot of misinformation out there about the Medicaid system, about what you can and can't do, what assets you can protect and what you can't protect. And so really, when that situation presents itself, it can be overwhelming. But being able to help that client to sift through the laws, come up with a solution is a invaluable resource to have, to be able to sit across from a client that's already in a tough situation and be able to offer them hope, to be able to offer them a solution to their problem. For example, I've had many clients in my office, one in specific recently that came in, and before we could even sit down, they were already in tears. And so you can tell from that they're already going through a lot. And they were told by the nursing home that because their house was in a revocable trust, that they were going to be ineligible for Medicaid. They were denied by the Medicaid office. And so we sat down, analyzed their situation, and came up with a solution which protected their house. But not only their house that was in risk, they also had a sizable estate in bank deposits. And Medicaid, of course, was telling them they were going to need to spend that down to $2,000, which is the state minimum or state maximum that you can have in assets. What we did was came up with a solution that allowed the client to protect over half the estate of bank deposits and the house. So by the time we were done presenting the proposal, going through with the paperwork, applying for Medicaid, not only were they protecting the house, which they thought they weren't going to get to protect, they were able to protect over half the estate and get the care that their loved one needed. You know, a lot of times that's the most important thing. In most cases, that's the most important thing is making sure the loved one's taken care of. The finances are kind of secondary, although, you know, they're still important because you have someone that worked their entire life, worked hard, has a house, has their life savings, and they just happen to get sick towards the end of their life. Well, when it's presented to the family, most of the time the option that they're given is you need to spend everything. And oh, by the way, Medicaid can potentially take your house. when you can show a client a solution to that that doesn't entail losing the house, that doesn't entail spending everything, it really takes a load off of them. Then they can really concentrate on what's most important, which is their loved one and making sure their loved one gets the care that they need. I decided to specialize in Medicaid planning about 8 years ago. I've been a financial advisor for about 12 years, 13 years. I started in the business in 1998, and I helped clients over the years liquidate their entire account to pay for nursing home care, to pay for assisted living care. And once it gets to that point, long-term care insurance is not an option anymore. And so, I came to the realization that either I could continue to help clients liquidate their life savings or come up with a solution to it. And essentially what I did was worked with a local state legislator, an attorney in town, and we developed a system based on Medicaid law that would take advantage of what the law allows them to do. It would take advantage of all the ins and outs of the system because, quite frankly, the state doesn't make it known. There's not public service announcements. There's not billboards out asking you to look for this information, to look for that information. Here's what you can do. Here's what you can't do. Essentially, if you go to the state, they're not allowed to give you any advice. They're only allowed to interpret policy. And policy is you can have no more than $2,000 for an individual and qualify for state benefits through Medicaid. Well, we're not the state. We don't work for the state, so we can give advice. And to be able to help a family like that is the main reason I got into this specialized area of Medicaid planning, is to help a family to avoid having to spend an entire life savings that someone's worked their entire life for, worked hard hours, long hours, sacrificed a lot to build up a nest egg, to build a home for their family. And then they just happen to get sick in the later years of their life and it's gone. To me, that's not really fair.